Good evening,
Good
everyone.
evening to one and all. Thank you for joining with us. On behalf of Nash 24 by 7, I welcome you all in today's live Facebook program. I would like to introduce you all our speaker for the day, Dr. Bhupender Singh. Sir has done his MD in medicine and DNB in gastroenterology and is currently a consultant gastroenterologist, interventional endoscopist, and a hepatologist at Amar Hospital, Patiala. Sir has chaired and addressed at several national and international conferences. Alongside, Sir has numerous publications and research papers on his name. So, on this note, I would like to hand over the session to Dr. Bhupender Singh.
Good evening, everyone. At the outset, I would like to thank this platform of Nash 24/7 for giving me an opportunity to interact. Though it was scheduled to start at 7:30, sorry for the delayed start. Understanding the liver and Nash is very important because Nash or non-alcoholic steatohepatitis has become a very important disease which all physicians and gastroenterologists are seeing these days, and it is one of the most commonest diseases to affect the liver these days. So it is very important to understand the liver, the role of the liver in body, and the non-alcoholic steatohepatitis, so that we can control the disease and its progression. Why the liver is one of the most important organs. A healthy liver is a sign of healthy body. Liver happens to be one of the largest and overworked internal organs of our body. Healthy liver, we all know, is a when it is healthy, it is reddish brown in color, and it is of this almost size of a football that is flat on one side and weighs around 3 pounds. An importance of liver in the body can be assessed from the various roles played by the liver in the body. It includes controlling cholesterol levels, helping blood to clot, releasing bile, which breaks down fat and aids in digestion. The liver plays an important role to remove the toxins from the body and regulating the blood sugars and fighting infections and illnesses. Liver facts. It has a dual identity. It is uh, developed with an inborn capacity to regenerate itself, and 96% of the liver is water, and it happens to be second biggest organ next to skin in the body. It helps in hormone metabolism, and it has various different functions in the body, including cholesterol level determination. It helps in creating proteins and clotting agents, storing vitamins and minerals. So if we understand what are the important causes of the liver diseases, this include various viruses, parasites like hepatitis A, B, C, D, and E. Immune system abnormalities, which can affect the liver by making the immune system to dysregulate and attack the liver and its own cells, like autoimmune hepatitis, primary biliary sclerosis. As far as the genetics is concerned, important diseases to consider are hemochromatosis, where there is excessive deposition of iron, Wilson disease, where there is excessive deposition of copper in the liver, liver can transform into cancer, which is called as hepatocellular carcinoma. There can be cancer of the bile duct or liver adenoma. Other important causes of liver disease are alcohol abuse, which progresses from fatty liver to hepatitis to cirrhosis. Sedentary lifestyle leads to accumulation of fat in liver, like non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. What is Nafld? Non-alcoholic fatty liver disease, as we all know, is a condition where there is accumulation of significant amounts of excessive fat in the liver, not related to alcohol consumption. So here is the normal healthy liver, which is reddish brown, develops into a fatty liver, becomes loaded with fat, and then there is inflammation, steatohepatitis, and finally there is cirrhosis, which means liver is transformed into multiple nodules, and this is a irreversible state. So non-alcoholic steatohepatitis disease is a condition where there is liver injury and inflammation because of excessive accumulation of fat. Nash is the second stage of liver damage. First is just accumulation of fat. This is followed by liver injury and inflammation, which is the second stage. How prevalent is Nash and Nafld? Nafld is becoming, as I discussed, the most important chronic liver disease condition globally, affecting almost 1 in 4 people, and that is around 25-30%. Of those, 1 in 5 people living with Nafld will develop Nash. That is about 20 to 25%. What are the symptoms of Nash? Nash is a silent disease in which patients may not feel any symptoms. However, some may experience fatigue, weight loss, pain in upper belly, weakness, exhaustion. So it is important to know when and who should consider themselves or should consider themselves to be evaluated for Nash. Those who are having increase in AST/ALT enzyme levels, where there is fibroscan or ultrasound or radiological evidence of ultrasound discuss fat in liver. These are the conditions where one should be alert whether whether he or she is developing Nash. So how can person manage Nafld Nash? Very important. Non-alcoholic steatohepatitis disease, as we discussed, is happening because of the injury which happens to the liver cells because of the excessive accumulation of fat and associated inflammation. Healthy and active lifestyle can help prevent Nafld and Nash. So, developing a healthy lifestyle is the core of management of Nafld and Nash. Lifestyle interventions should focus on weight loss. It remains the cornerstone of management, and the importance of weight loss can be understood by the fact that losing at least around 10% of body weight over a period can reverse Nafld and improves Nash. Losing around more than 5% weight stabilize or improve fibrosis. and prevents Nafld progression to serious forms like fibrosis and Nash, and reverses the simple fatty liver. So, desired weight loss can be achieved by a healthy diet plan, physical activity schedule, and what are the dietary modifications? These include calorie restricted diet in patients who are overweight or obese to reduce weight and to improve the metabolic disorders. We should be consuming and eating healthy food, limiting portion and sizes, and maintain a healthy weight. And we should eat food with low glycemic foods and avoid high glycemic foods. The low glycemic index foods such as fruits, vegetables, and whole grains should be the cornerstone of the diet. And we should be restricting the fats and calories. Coming to physical activity, moderate intensity activities such as 150 to 200 minutes weekly exercise from 10,000 steps walking per day, aerobic exercises, dance, cycling, or strength training can halt the progression of Nafl to Nash and Nash to cirrhosis and prevent fibrosis and further damage to liver. Thank you very much for your patient hearing. And now we can have some question answers. If we have some, can you hear me?
Yes, sir. Thank you so much, sir. First of all, for such a lucid talk, sir. So, with your permission, sir, we'll take up some questions, sir. So, the first question is, how would I know if I have NAFLD or NASH?
As we discussed just now, that it is a very silent disease. It may not show any symptoms except for uh, early bloating, early fullness of abdomen, or right upper quadrant discomfort, upper abdominal discomfort, fatigue, and those patients who are having pre-existing illness in the form of diabetes, hypothyroidism, obesity, or metabolic disorder should be very alert and getting themselves screened regularly for early pickup of Nafld or Nash. So once we have the suspicion, we should undergo investigations in the form of ultrasound and blood investigation in the form of liver function test and consult your physician.
Right. So, sir, the next question is, can ultrasound help in detecting cirrhosis? I had done my ultrasound test last month and the findings were fatty liver only.
So it's a very good question. Though practically seeing, ultrasound is good at picking up cirrhosis, but a good test, a reasonable non-invasive test, which can better pick up cirrhosis at earlier stages and fibrosis at earlier stages, is fibroscan. So if you have any doubt, this is the test of choice, because this is the non-invasive test, and I think it is now available in most of the good cities across India.
Right. So, sir, the next question is, I have grade 2 fatty liver and my age is 43. Can yoga and exercise alone can help me to overcome fatty liver, or medications are required?
Definitely, physical activity remains and the weight loss remains the cornerstone of the lifestyle modification which is suggested for Nafld patients. But as far as medications are concerned, are also available nowadays and should be started only in consultation with the gastroenterologist or physician who will investigate you and, if necessary, you will be prescribed according to the investigation which will be suggested by the physician in the form of liver function test, ultrasound, lipid profile, blood sugars, thyroid function test, renal function test. So it is important to consult a physician and remain under his supervision. Though lifestyle modification is definitely can be done by the patient himself, the medication should part should only be handled by the physician or the gastroenterologist.
Right. So the next question is, I don't drink alcohol, but I have grade 2 fatty liver and I smoke very often. Will it affect my liver?
Uh, Grade 2 fatty liver, I think it's important to understand the even though patients who are this is Nafld is a condition where the requirement of the disease is patient is having insignificant intake of alcohol and still gaining accumulating fat in liver. So there is something wrong with your metabolism. Then only excessive fat accumulates in the liver. It can be ranging from obesity or hypertension or any metabolic disorder in the form of hypothyroidism or excessive smoking usually is closely associated with metabolic derangements. So it is advisable to cut down on smoking also because this disrupts the fat metabolism and has important role in increasing the oxidative stress on the body as well.
Right. So, sir, the next question is, should I get my liver tested even if I am healthy? And if yes, then how often?
I think this is an important question uh, because it is a silent disease, as we discussed. So it is better to pick up the disease as soon as possible. For that, I think screening of patients is suggested, especially those who are having high risk in the form of family history of liver disease. There is history of pre-existing obesity, diabetes, hypothyroidism, or metabolic disorders. Hormonal imbalance should get themselves screened regularly for picking up non-alcoholic fatty liver disease and Nash at the earliest. So for that, I think liver getting yourself tested with liver function or maybe a fibroscan regular basis. And those who are having high risk, especially beyond the age of 40, if there are symptoms, one should definitely get himself or herself screened for Nafld, Nash in the form of liver function test and ultrasound, at least, if possible, with fibroscan.
So next question is, by doing blood test, can I come to know that whether I'm having fatty liver or not?
I think liver function test, which is so widely available, helps in picking up the early elevation of enzymes, even when the symptoms are not there. We see so many patients daily who are not having much symptoms, but they have their liver function deranged. So that can only be picked up with early screening with liver function test.
Sir, the next question is, can children also develop NAFLD or NASH?
Given the era which we are living, yes, there are so many kids who are coming up with fatty liver, and the reason is this sedentary lifestyle, especially those who are taking a lot of junk food and doing little physical activity, and especially kids are getting obese. The current lifestyle is such that there is less importance given to the physical activity, especially the urban areas. There is a lot of prevalence of fatty liver amongst the children as well. So importance of physical activity and getting kid engaged in some kind of sports or if regular physical activity can bring down this prevalence of Nafld in kids.
Okay. Sir, next question is, do I need to consult a dietitianist or a nutritionist if I am having grade 2 fatty liver or grade 3 fatty liver?
Yes, I think it because the mainstay of therapy or Nafld management is diet management only. So it is important to meet a good dietitian who can help you in making changes to your diet so that you can cut down on the calories and fats and help you in management of Nafld.
Right. So, sir, next question is, what type of exercise or what type of diet should I take? I have grade 3 fatty liver and my LSM value is 9.7.
LSM value of 9 indicates only fibrosis. This is a stage where one should be alert and seek the help of a gastroenterologist who would suggest you drugs according to your liver function test and other parameters which will be evaluated. And the importance of physical activity in the form of 150 minutes to 200 minutes of exercise every week can restrict your progression further to frank cirrhosis and maybe help you in reversing also to some extent your disease to some extent. So it's important to have a good dietary management and good schedule of physical activity. One is obese and overweight, should cut down on your weight. We just saw the importance of losing 10% of weight, which goes a long way in managing Nafld.
Sir, we'll take up last question. So the question is NAFLD genetic?
I think it is a interplay of so many things. It is just not genetics. It is has genetic roles where there is impaired metabolism, which disables a person to metabolize the fat in the body, which keeps on accumulating in the liver. Definitely, there is a role of genetics, but it's just not genetics alone. There is a role of environmental factors in the form of the diet being followed, the exercise schedule being followed by the person, whether the person is obese or gaining weight, being on drugs. On certain drugs can increase your weight and keep your fat accumulating inside the liver and progress to advanced stages of liver damage. So it is important to understand the whole physiology that is just not genetics. The interplay of genetics, environmental factors, and the trigger by the accumulation of fat and subsequent inflammation, which damages the liver, and if the things are not handled in time and not picked up in time.
Right. So thank you so much, sir, for addressing all possible queries and for such a wonderful and informative session. I'm sure this session would be very helpful for the fatty liver patients and their caregivers as well. I would also like to thank all our audience for their active participation. So thank you so much, and thank you so much, sir, once again. To stay updated on fatty liver, NAFLD, NASH, and liver health, do like and follow our page Nash 24/7. Thank you, everyone. Thank you so much. Thank you, sir.
Bye. Thank you, and